Hello, my name is Dr. Damon Daniels, founder of the Size-Wise Weight Management Program. Today I want to talk to you about the A-B-Cs of good diabetes care. Diabetes is a major health problem in our country today. As a matter of fact, in the state of South Carolina, where I live, the cases of diabetes are staggering. We rank 16th in the country in the number of cases of diabetes. This is a medical problem that leads to a lot of complications, including heart disease and stroke. As a matter of fact, if you're diabetic, your risk of having a heart attack or stroke is almost double someone who doesn't have that. So we're going to talk about how you can take better care of your diabetes. Again, I mentioned the A-B-Cs of good diabetes care. A stands for A1C level. B stands for blood pressure. And C stands for cholesterol. So let's talk about A. The A1C is a blood test that allows us to find out how well controlled your blood sugars are. It's a single number that relates to the amount of blood sugar control you have 3 months prior to the test being taken. Ideally, you want your A1C level to be less than 7.0. B for blood pressure. If you're diabetic, you want to have good blood pressure control. Ideally, you want your blood pressure to be 130/80 or lower. This is because it significantly reduces your risk of heart disease, stroke, and kidney disease. C stands for cholesterol. As a diabetic, you want your total cholesterol to be less than 200. In addition, there's a cholesterol called the LDL cholesterol. You want that number to be less than 100 if you have diabetes. Now let's get back to A again. So how do you keep good diabetes control? The key to having a good A1C, again that is an A1C that's less than 7.0, is to watch your carbs. Or in layman's terms, sometimes we call it watching your sugars. You've got to be able to know how many carbs you're taking in on a particular day. And an easy way to manage your carbs is to use something called the plate method or the fist method. I'm going to talk a little bit about the plate method first. So when you look at your plate, if you divide it in half, all right, so you have 2 halves on your plate, and then take one of those halves and divide it in half. That gives you one side of the plate as a half and then 2 quarters. And that larger half, you want to have something green in that area, a healthy salad. Some green vegetables. That fills up half of the plate. Then in one of the quarters, you want to have a healthy protein, say some broiled fish or chicken. And then in that last quarter, you want to have a starch, which could be some pasta or rice or potatoes. For most Americans, it's actually flip-flop. Most people will put most of those carbs in that half, and that's not the way you want to do it because that can elevate your blood sugars. So that is the diabetes plate method. And in general, if you follow that, you'll have a diet that's lower in carbs, higher in healthy proteins. Let's talk a little bit about the fist method. Maybe you're saying, well, that's a little bit too complicated for me. What's something that's even simpler? I call it the fist method. And basically the way that it works is that when you eat a carb, if you can put that amount in your fist, that is a single serving size. And you want to have no more than 1 to 2 fistfuls of a serving size per meal. And in general, that'll keep you in the carb level that you need to be in to keep that A1C at the level it needs to be. A little bit later, we'll talk about weight loss because weight loss is also a very, very big key in keeping your A1C under good control. Let's move on to blood pressure. So again, as I mentioned, blood pressure control is very, very important. And the key, a significant key to keeping your blood pressure under good control is to have a healthy weight. As a matter of fact, it only takes 5 pounds of weight loss to lower the top number of your blood pressure anywhere from 5 to 10 points. So as you can see, the more weight you lose, the better your blood pressures will be. So weight loss is a very, very important key. Exercise is very important as well to keeping your blood pressure under control. Did you know every time you exercise, the blood vessels in your body relax and your pressures actually come down? It is an effective way of managing your blood pressure, the weight loss and regular exercise. Lastly, C, cholesterol. Again, as I mentioned, you want your bad cholesterol, the LDL cholesterol, to be less than 100. And this is primarily through your diet. So you want to eat foods that have lower cholesterol in them. You want to avoid red meat. You want to avoid foods that have a lot of sauces in it. The other areas where I see patients run into problems is fast food and eating unhealthy snacks. All of those tend to have higher cholesterol values in them. So those are just some tips to keep your A-B-Cs under good control. This is one of the things that I'm passionate about in SizeWise. We have an excellent program that can help you get better control of your diabetes. I have a team of professionals, two personal trainers, a health coach, and myself, and we have what's called a medically managed weight management program. I will be responsible for monitoring your diabetes control. Our trainers will help you with your exercise and fitness. We have one of our trainers that he has over 20 years of experience in fitness. And then our health coach will give you tools to stay motivated to continue to reach your weight loss goals. So I hope this session was helpful for you. Stay tuned for more. We have some good information. And check out our webpage for SizeWise. Have a great day.